Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
All right, so we all want to live those long and healthy lives, right? At least I know I do, even though I haven't always made the best choices for that myself.
Well, we all have those moments.
Oh yeah, definitely. But speaking of long and healthy lives, there's this new study in the Lancet Public Health, and it kind of threw me for a loop. It says that life expectancy increases, the ones we've kind of just come to expect. Well, they've actually been slowing down across Europe since like 2011.
Yeah, it's a surprising finding. And it's not even just a gradual slowing down. In a lot of European countries, the increases have actually just completely stopped. Like we've always thought we'd live longer than our parents and they'd live longer than theirs. But the study is kind of saying maybe we gotta rethink that whole idea.
So, like, not quite the fountain of youth secret I was hoping for.
Not quite.
Okay, so going into this deep dive, I was thinking we'd be figuring out how to live to 150, but now it seems like there's a real mystery here. So what's the deal? Why aren't these life expectancy numbers going up like they used to?
Well, the study points to a few things, and you've probably heard of most of them. Obesity, high blood pressure, high cholesterol, not enough exercise, that kind of thing. But here's the thing that really gets me. These haven't just stayed the same. They've actually either gotten worse or stopped getting better over the past few years. It's almost like we're going backwards.
So it's not like we've hit some limit on how long we can live. It's more like our lifestyles are catching up with us.
Exactly. And to add another layer to all this, the study shows that older adults are actually still seeing their life expectancy go up in a lot of places.
Yeah.
So we know it's possible to live longer, but something's going on in our younger years that's holding us back from reaching our full potential.
That is fascinating and, yeah, a little worrying.
Yeah.
I'm curious, though, did COVID have anything to do with all of this?
Oh, absolutely. COVID definitely had a noticeable impact on life expectancy, especially between 2019 and 2021.
Yeah.
But the researchers are careful to say that COVID isn't the main reason for this longer trend. It's more like it just made existing problems even worse.
So it sounds like there's a lot going on here, choices we make, and maybe even, bigger things like what's happening in society overall. Did the study look into that at all?
Definitely. And one of the things that really jumped out was that some countries actually managed to avoid this slowdown. They've kept and even improved their life expectancy gains.
Okay, that's really interesting. So maybe there's something we can learn from those countries. Who are these superstars and what are they doing differently?
Well, the ones that stand out are places like Norway, Iceland, Sweden, Denmark, and Belgium. What's really cool is that their success seems to be tied to government policies that really put a focus on healthy lifestyles and actually support people in making healthy choices.
So it's not just about individual willpower. It's also about, creating environments that actually make it easier for people to be healthy. What kind of policies are we talking about here? Are they doing something totally different?
It's not necessarily about huge changes. It's more like they're consistently focused on creating a culture of health. They've got policies that encourage healthy eating, and they make it easier to be physically active, and they really prioritize public health in general. For example, they invest a lot in public transportation and make their cities more walkable and bikeable, so it's easier for people to get some exercise just as part of their daily lives without even really thinking about it. And they've got strong rules about food marketing, especially to kids, and they often help make healthier foods more affordable. So they're basically trying to make the healthy choice the easy choice.
Makes sense. So while England hasn't been as successful, it seems like those Nordic countries are doing something right. I'm starting to feel a little more hopeful. Maybe this slowdown isn't inevitable, but we need to think bigger about the problem. It's not just about telling people to eat their vegetables. It's about creating systems that help them do that.
You're totally right. And that's one of the things that makes this study so important. It's not just about the data. It's about making us think about the choices we make, both personally and as a society.
Okay, before we go too deep into the big picture, let's bring it back to you, the listener. We're not just talking statistics here. This stuff actually affects your life, your health. So what does all this mean for you?
It means that even though we're seeing this overall slowdown, you still have a lot of control over how long and healthy your own life is.
You're saying we're not just along for the ride. We can actually, steer the ship a little.
Exactly. Even with these trends, you can make a big difference by focusing on healthy habits, like eating right, getting enough exercise, and keeping things like your cholesterol and blood pressure in check. It's about taking charge of your own health and making choices that'll help you in the long run.
Okay, so even though the big picture might be a bit scary, there are things we can do to, improve our own odds. But I'm actually kind of curious about the research itself. Where did all this data come from? How do we know this slowdown is actually happening?
Well, that's where the Global Burden of Disease Study 2021 comes in. That's where all this data is from.
Yeah.
And it's a pretty amazing project.
Okay, I've heard of that study, but I gotta admit, I don't really know much about it. What makes it so special? Like, how is it different from other health studies?
Well, imagine like a huge team effort with like thousands of researchers from all over the world all working together to understand how diseases and all these risk factors affect different populations. That's basically what the Global Burden of Disease Study is. It's the biggest, most comprehensive study out there trying to measure how much diseases are affecting us, and it looks at a ton of different factors. Infectious diseases, lifestyle choices, the whole shebang.
So it's not just about how many people are dying from certain things, but like how those things are affecting everyone's health and how long they live.
You got it. It's way more in-depth than just looking at death rates. It helps us understand the real impact of diseases on a global scale. And because it involves researchers from so many countries, we get a truly global perspective. It's not just one region, it's the whole picture.
And this specific study on life expectancy in Europe, which countries were they looking at? Just those Nordic countries we were talking about before?
Nope, it was a lot more than that. They analyzed data from 20 countries: Austria, Belgium, Denmark, Finland, France, Germany, Greece, Iceland, Ireland, Italy, Luxembourg, the Netherlands, Norway, Portugal, Spain, Sweden, and the UK. And of course, the UK includes England, Northern Ireland, Scotland, and Wales.
So a good mix of countries with different healthcare systems, different ways of life, makes the comparisons even more interesting. And they looked at trends from 1990 to 2021. That's a pretty long time.
It is. And to really see how things have changed, they split that time into 3 periods: 1990 to 2011, 2011 to 2019, and 2019 to 2021. That way they could pinpoint exactly when that slowdown in life expectancy started, which, like we said, was around 2011.
Okay, so we've established that this slowdown is real. It's based on solid research, and it seems to be connected to both lifestyle choices and maybe even, those government policies. But before we go full on doom and gloom, I remember you saying there was a bit of good news in there somewhere. Can you remind us about that?
Absolutely. One of the big takeaways is that there's no, set limit on how long we can live.
Yeah.
There's still room for improvement, and that's a big deal. Like I mentioned earlier, in lots of places, older adults are still seeing their life expectancy increase.
Right.
So it's not that we're destined to live shorter lives. It's more about making sure we're doing the right things, especially when we're younger, to set ourselves up for a long and healthy life.
So it's like we've built a good foundation for living longer, but we got to be more proactive about keeping it strong.
Exactly. It's kind of like building a house. You can have a super solid foundation, but if you don't take care of the roof and walls, eventually the whole thing's going to start falling apart. And that's where those government policies we talked about come in. They can be like a support system, helping to maintain and even strengthen that structure.
So it's not just about what we do as individuals, but also about creating environments and systems that make it easier for everyone to be healthy.
You got it. Think about it. If healthy food costs more, and it's harder to find than processed food, if our cities aren't designed for walking or biking, if we're constantly bombarded with ads for unhealthy stuff, it makes it way harder to make those healthy choices, even if we're trying our best.
Yeah, it's like we're fighting an uphill battle against our own environment. No wonder we're seeing this slowdown.
I like that. That's a great analogy. And that's why it's so interesting to look at those countries that are putting public health first. They're basically trying to level the playing field, making it easier for everyone to live a healthy life, no matter how much money they make, where they come from, or where they live.
So we've covered a lot of ground here. The slowdown in life expectancy, what's driving it, the role of personal choices and government policies, and how important it is to have environments that support healthy living. And we dug into the research itself, how it was done, and where the data came from.
We've also seen that even though there are some worrying trends, there's still reason to be optimistic. We have the power to change things, both individually and as a society.
And I think that's the main point here. Even though this study presents some tough realities, it also gives us the power to do something about it. It reminds us that we have a choice, both in our own lives and in shaping the policies that affect our health. So where do we go from here? What can we do with this knowledge? How do we turn understanding into action?
Yeah, that's the big question, isn't it? We've uncovered this fascinating and honestly kind of scary trend, but what do we actually do about it? How do we go from just knowing about it to actually doing something?
Well, that's where it gets really interesting because it's about taking what we've learned and turning it into actual steps we can take for ourselves and maybe even for our communities.
Okay, I like the sound of that. Let's start with what we can do on a personal level. What are some things people can do right now to up their chances of living a longer, healthier life?
The good news is that a lot of the things we've been talking about, those risk factors, well, you can actually do something about them. You really can make changes that make a big difference. So there's still hope, even for those of us who, maybe haven't been living the healthiest lifestyle.
Of course. It's never too late to start making good changes. And the best part is you don't have to turn your whole life upside down. Small changes that you can stick with
Hmm.
over time, those can make a huge difference.
Okay, I can get behind that.
Yeah.
So what are some of those small changes that can really add up? Give us the to-do list.
It all starts with the basics. You've heard them before, but they're worth repeating. Eat a balanced diet, make sure you're getting enough exercise, and try to maintain a healthy weight. And of course, if you smoke, quitting is like the best thing you could do for your health, hands down.
Yeah, those are all great in theory, but I think a lot of people struggle with actually, making them happen. Life gets in the way, willpower fades, and suddenly that bag of chips is looking pretty good. Any tips for making those healthy choices stick?
One thing that can really help is to focus on making changes gradually, instead of trying to change everything all at once. Pick one or two specific things you want to work on that seem doable and start there. Like instead of overhauling your whole diet, maybe just start by cutting back on sugary drinks and drinking more water. Or if you're not used to exercising regularly, start with a 20-minute walk a few times a week.
I love that, starting small and building from there. It's not about punishing yourself. It's about making changes you can actually live with, right? It's a marathon, not a sprint.
Exactly. And find something you actually enjoy. If you hate running, don't force yourself to run. Find something that gets you moving that you can stick with. Maybe it's dancing or hiking or swimming or even just playing with your kids or grandkids. The point is to make it fun and something you can keep doing.
Speaking of support systems, what about doctors and nurses? How can they help with all of this?
Oh, they're super important for prevention and catching things early. Going for regular checkups, getting screenings, and talking openly with your doctor about your health history and your lifestyle. Those can all help spot potential problems and figure out ways to lower your risk. Don't be afraid to ask your doctor for advice and support. They're there to help you reach your health goals.
So we've talked about what individuals can do, but what about the bigger picture? We talked about how government policies can make a difference, but what can we do as individuals to create healthier environments for everyone? It seems kind of overwhelming to think about, trying to change government policies. Where would you even start?
It can definitely seem daunting, but remember, every voice matters. You can start by learning about the health issues you care about and the policies that affect those issues. Once you know what's going on, you can advocate for change in different ways. Contact your elected officials, support organizations working on these issues, talk to your friends and family about how important public health is. Policy change often starts at the grassroots level.
So it's about using our voices and our votes to create a world where everyone has the chance to be healthy, not just a lucky few.
Yeah. It's about pushing for policies that make healthy food affordable and easy to get, that create safe and inviting places to be active, and that prioritize prevention and catching problems early. It's about building a culture where everyone benefits from good health.
I really like that idea. So to wrap things up, I think the big takeaway here is that even though the study shows some challenges, it also shows that we have the power to do something about it. It reminds us that we have choices in our own lives and in shaping the policies that affect our health. So cheers to a longer, healthier future for all of us.
Cheers to a healthier future. And remember, even small changes can make a big difference. Don't underestimate the power of your choices.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.